Hi everyone, my name's Alex. I'm a medical student at UEA in Norwich. Medical school can be pretty difficult at the best of times, but lockdown really has thrown everything up in the air. Some people have exams, some people don't. Teaching online is different at different universities and everything's just a bit messed up. Even if you haven't got an exam, there's always pressure to know the huge amount of content you need to become a doctor. So here are some of my tips to keep going while you're away from campus. There's two main branches to this. Number one is tips for studying, and number two is just general advice. So let's start off with studying. The best thing I think you can do, above all else, is to reorganise all of your files, all of your notes, your questions, everything else, whatever you do to keep track of the content that you learn. Reorganise it all and make sure you've got everything where it should be, all the notes you need, questions you've written, resources, links to papers, PowerPoints or lecture notes or whatever. Make sure it's all neatly ordered in topics or by week or however you learn at your university. Make sure it's done, because when you come to learn it for summatives or come to revise it, you really want to have it all there so you don't have to trawl back through previous year's notes and previous year's work, or ask your mates if they've got it, or go back through old lectures. You want it all there ready to go so you don't have to faff around with it before you start. Second tip, and this is really important as well, is to make your studying focused on the clinical side of medicine, because it can be very easy, now you're not on placement or you've not got OSCEs to prepare for, just to sit and learn stuff out of textbooks. But it's really important, if you want to actually be a good doctor when you qualify, to make sure what you're doing is clinical. I mean, you're not going to be treating textbooks, you're going to be treating patients. So if you're learning something or you're revising something, just have a think on how it relates to a clinical scenario, or think of a clinical scenario, or think of a patient who you've seen on placement, or someone that was in an OSCE, or I don't know whether other medical schools have access to this, but we have access to an app called Capsule, which has lots of different clinical cases on for all the different areas of medicine and questions to follow it, and it really helps you sort of think through and puts everything into context so you know that what you're studying is relative to patients. My second tip is to study with friends on Zoom or FaceTime. So what I do is a group of four of us will each write sort of 20 questions, some of them clinical based, some of them just factual recall, some of them explaining, just varied questions on a topic each or two topics each, and then we'll have a Zoom call about once a week, and sometimes more often than that, and we'll ask each other questions, and that way you're socialising. A lot of the time it's clinical, so it's clinical related. You're problem solving, which I'll come on to in a minute, and it makes revising a lot more interesting. And the big thing for me for revising in groups with questions is that your friends, by asking you questions, will often pick up areas that you don't know. So they'll pick up holes in your knowledge. So then they can explain it to you, and then you can note down that you didn't know the answer to it, and then go and direct your own revision around that. So it picks up, it's like a bit of a sieve. It picks up what you don't know. The best way to revise is to answer questions. Irrespective of lockdown, just answer some questions. But especially in lockdown, just sitting there on your own in your room or wherever it is you're studying, writing reams and reams of notes, what is it doing for you? You're not going to be able to focus very well. It's going to be completely boring. What a complete waste of time. You'll ruin your morning or afternoon or whenever, and you won't have time to do anything else. So I recommend just going back through lecture notes or whatever, however you like to learn, and just writing some questions on each lecture. And then when you go through and answer them, you can answer them verbally, you can answer them in your head, or what I like to do, works really well for me, is to write them down, especially if it's a longer question or I don't immediately know the answer to it. So then I can track my thought process as I'm writing it, and I can work out exactly which bit I don't know and then go and look that up. My next tip is to problem solve. Now this kind of links in with questions and being clinical and talking it through with your friends. But problem solving is crucial, it's really important. If you don't problem solve, you'll lose the ability to problem solve. You'll lose your clinical reasoning skills. You'll also find it a lot more boring if you're not problem solving. So you can do, as I mentioned earlier, go through clinical cases or try and work things out without looking them up. That works really well, and just answer questions, as I said. My last tip in this section is to find new ways to learn and new ways to study. So I've personally found this anatomy colouring book. It's quite therapeutic, and although it's not as good in terms of bang for your buck as revision, it's a nice way to study. It's really fun, and I'm not very good at anatomy, so it really helps me do that. Something else you can use is an app called MedSchool. I found it really important to run through clinical skills and perhaps even history taking, either with friends or family or just on my own. Just play back clinical skills in my head, just to make sure I don't lose that memory, because while we're engrossed in learning things and revising the actual theory, we might forget that being a doctor is actually a clinical job. You need clinical skills, and we've also got OSCEs when we get back. It's good to keep fresh on OSCE skills, it's good to keep fresh on clinical skills, and I found MedSchool really helps me with that. It's got a step-by-step breakdown of all the clinical things you need for your OSCEs, so all the different examinations, investigations you might need to do, history taking, lots of different things. So I'd recommend getting that. I think it's about £12 for the paid version, which is a bargain if you ask me. So the second part of this video is focused on sort of general advice for lockdown. So the main thing I'm going to talk about is goals. I recommend getting yourself a notebook. Well, you've probably got a notebook because you're a student, and writing down a few long-term goals that you want to have achieved in, for example, in about a year or a couple of years. They can be medicine related, it could be an exercise goal, a sporting goal, so you might want to be able to run a marathon or cycle 100 miles. It's up to you. So write yourself a few goals and then start to break them down. So that's your long-term goals. Break them down into short-term goals. So what are you going to do over the next month, for example, or a few weeks, which is going to help you achieve those long-term goals. And then you can further break that down into daily goals. The way I like to do this is every morning I like to write a load of things that I want to get done in the day. It can be over ambitious. I'm quite often over ambitious, because then I know that I've always got something to be getting on with, and then you can just tick them off throughout the day as you go. I find this really helps me to focus on each day as it comes, and I don't tend to feel like I don't know what to do, because I know I've got the short-term goals in place that I want to achieve in the next sort of month, and I know that if I do my goals each day, I'll reach that short-term goal, and if I reach all my short-term goals, I'll reach the long-term goal. So it really helps me keep focus and look at the bigger picture. One of the great things about being so focused every day on what you need to get done is that you'll find yourself with a lot more free time. So the things you want to do won't sort of expand and you'll be really unproductive. You'll get them done in a really short space of time, be really productive, and then you'll have the rest of the day to do whatever you want to do. Things that aren't on your list, enjoy time with your family, get lots of exercise done, things like that. And that brings me on to my last tip, that's to enjoy yourself and do exercise. So if you don't do any exercise while you're sort of shut up inside, you'll probably quite quickly find you don't sleep very well, because you won't be tired enough, you'll just be sitting inside studying, and you won't be able to study very well. Firstly, because you won't have slept, and secondly, you just won't focus very well. Yeah, just get outside and exercise, guys. Try and get it done early in the morning if you can. That's my favourite thing to do. Once it's done, it's out the way, and I find it really helps set me up for the day as well. So if I've done some exercise in the morning, then I think that's the first thing done. I feel really good for that. I can get on and do the second thing and the third thing and the fourth thing and smash through everything. And then often by lunchtime, or sort of 3 o'clock in the afternoon, I've done everything I want to do, no more jobs left to do, and I can go and do whatever I want. That little bit of exercise in the morning really gives me a boost, so I'm sure it will do to you too. That's my lockdown advice to fellow medical students. Just to summarise, reorganise your stuff, be clinical, answer questions, problem solve, study with friends, find new ways to learn, and set lots of goals and exercise. Please like this video if you enjoyed it or found it useful, and drop a comment if you have any other tips you want to share.